Good afternoon. We are now live on Path Tuesday Table Talk, Patient Advocates Transforming Healthcare. Welcome to our winter season and our first Table Talk of 2021. Happy New Year to everybody. Thank you so much for joining us for this very important conversation we're going to have today as part of our Empowering Partnerships series. Today's topic will be increasing patient involvement in cancer research. My name is Hala Dara. I'm the founder of PATH as well as a patient family engagement consultant. PATH is a diverse, passionate coalition of independent healthcare thought leaders who seek to transform healthcare through integration and advancement of patient, family, caregiver, and community engagement. Through our coalition, advocacy, experience, and expertise, we serve as trusted partners in the quest for a more equitable and community-centered healthcare system. As I mentioned, we are launching our Empowering Partnership series for our table talks this winter. And I am really pleased to have today one of my fellow PATH members, a cancer advocate and researcher, as well as a cancer survivor herself, Kimberly Richardson, who will be leading us through today's discussion and conversation with her colleagues today. I also want to remind our guests who are watching live on YouTube, if you'd like to send us questions during this stream, please feel free to do so. You must be signed into your YouTube account, but certainly we hope to get to your questions today. And on that note, I'm going to kick it off back to my friend, co-host, and PATH partner, Kimberly Richardson, to start our conversation. Kimberly?
Thanks, Hala. Good afternoon, everybody. Happy New Year. Happy Inauguration Eve. As Hala said, today we're going to kick off this series talking about the patient and the patient's involvement in cancer research. And I am more than honored today to have on the panel with me four extraordinary women who are largely responsible for the advancement of my advocacy in terms of research advocacy. And so we're going to start by introducing them all, and then I'm going to ask them a few questions, and we're just going to really talk about the role of a patient advocate and their role and the importance of them being involved in cancer research. Today on our panel, we have Dr. Nita Lee and Drs. Katie Kernit, who are both gynecological oncologists from the University of Chicago. And we also have Dr. Shannon McLaughlin and Dr. Alam Al-Khamadi. They are both from the University of Illinois at Chicago. Dr. McLaughlin is a gynecological oncologist and researcher, and Dr. Al-Khamadi is the administrative director of the UIC Cancer Center. And so we're going to start with Dr. Lee. Dr. Lee, you and I both met. I think we met both at a gynecological conference for cancer patients. And I wanted everyone to know a little bit more about you in terms of your work as a clinician, how we came to know one another, and then more or less the importance of patient advocacy in your work. I need you to unmute.
Following the basic rules. I'm a GYN oncologist, so I do surgery and do chemotherapy and clinical research in women who have GYN cancer, so ovarian, cervix, uterine cancers, just like some of my colleagues here today. And I think that in terms of advocacy and patient involvement, the first way I really started to get involved was really through patient involvement in education events. And so a lot of times advocacy does start that way. So patients who are interested in sharing with their own community members about their own cancer or about, other ways for prevention or diagnosis or treatment. So that probably was my input into that. And after working in that area and having clinical research that was really around the patient perspective for cancer care, I ended up joining in our cancer center, our Office of Community Engagement and Cancer Health Equity. And I now lead that office. And now our focus has really shifted from just more than just education, but truly sort of more equitable engagement in the research area. So I think that's kind of my transition, has been from really being patient focused, starting a lot of small activities and small events from patient connections that I had made. And then you and I met, and you weren't my patient, but at the same time we met at a venue where we started discussing the real importance of what could we create, what kind of space we could create. And I think that was really exciting for us in terms of what we worked on last year or the year before now.
And so let's speak a little bit, Dr. Lee, about the Gynecological Research and Survivor Summit, because that's where we really started to work together on projects.
It was so exciting. It was all, and I think you're right that I think when you and I met and we said, okay, well, we want to have a space where gynecological cancer patients can come, and researchers who are both trainees and researchers and clinicians can meet in a forum that can really hear both people's perspective and both groups' perspective, is when we designed it. I will say we had it on February 29th, 2020, which was like the absolute last mass event before COVID. So I'm so glad that we were not a super cedar event, because I think we spent the whole afternoon like hugging each other and like everybody was like in a love fest.
I know, right?
So, but I think the important thing was what you said, was that when you presented the idea, I wasn't like, oh, does this fit in with my, like, you know, my activities that I'm doing? And I was like, yeah, why can't we do this? Right. And so I think that's the important thing of like thinking creatively and not being afraid of saying like, oh, like, is anyone going to give me like permission or whatever you want to call it to do it, and just to say, yeah, I think we're going to start it, and we're going to be bold, and we're going to call it the first annual, and we're going to make it happen. And that was a really exciting event where we had about 85 participants, who were survivors, some trainees, residents, nurses, basic science researchers presented, and everybody got to both hear about what the researchers were doing, but equally important, got to do these different breakout sessions where we just sat around and talked about the experiences as a researcher, as a clinician, or as a patient on sort of an equal setting. And I think that was the equal setting part, and the space for everybody to say their piece and to say what's going on was really important.
I agree. I think the whole concept behind the summit was supposed to be this sort of bi-directional learning experience where the advocates and caregivers and patients learn from the students, learn from the oncologists in those breakout sessions. Dr. Kearney, you were a part of that planning process with us over at UFC. Give me a little bit of your feedback on the summit, and then tell our audience a little bit about what you do.
Sure. Thanks, Kimberly. And thanks for having me. I'm excited to be here. So I think that I had just joined the University of Chicago maybe 6 months or so before that. And my interest was in research and clinical trials, and finding kind of ways that we could kind of engage with patients and increase understanding of research to maybe be able to broaden our options for the patients that we treat. And so I met Dr. Lee. She's one of my partners. I'm similarly a GYN oncologist, so I do cancer surgeries and chemotherapy. And she had been planning this with Kimberly for a long time. And so I kind of came to it with the interest in trying to help find ways that we could, expand understanding of research for patients. And so for me, the thing that stood out on that event was first how much enthusiasm there was, not just from patients, but also from their families, from advocacy groups, from researchers, basic science researchers who don't interact with patients very often, and also from our trainees. I think that was a really critical part. Then when we were planning it, we thought it was really important that we're not only trying to, I'm trying to expand my own understanding and interest, but also to teach our trainees, like engaging with patients and advocacy groups and trying to bring them into the conversations about research is really important. And so the big takeaway for me was really how engaged everybody was, how interested people were, even in things that were outside of, anyone's specific understanding before coming there. It was amazing how quickly everyone was able to pick up on kind of big themes and some of the nuances of research that I think is so critical for patients to understand.
I totally agree. I think that one of the things that continues to be a part of my research advocacy work, a little bit about my background as a cancer patient, 8 years as a survivor of a rare form of ovarian cancer. It was at the time not too much information on the internet about my rare form of granulosa cell tumor. And just my interaction with my oncologist at the time, trying to get more information as I went through treatment and got through recovery, it became very, very clear to me that I wanted to expand what I understood about ovarian cancer. And I wanted to be involved with advocacy organizations that were doing that kind of work. And initially, I started out as an awareness advocate, which most people who go from being either a patient or a caregiver, they do that first. It's more the health fairs and the 5K runs. And I did all of those kinds of things. But I think when it got to a point where I was really wanting to learn more about ovarian cancer research, I started asking the very pointed questions particularly about, well, how is this affecting African American women? And when I started to learn that the data really wasn't as strong, not only for ovarian cancer in the first place, but for rare granulosa cell tumor, and then a deeper dive into it in terms of socioeconomic data, I became more involved in wanting to know more at a policy level. And so the ironic part about how I came to the University of Illinois at Chicago, I was at an AACR meeting, and there were several delegates from the University of Illinois at that meeting. And we marveled and sort of joked at the fact that here we are in this room in Atlanta and didn't know we existed in Chicago. And so I graduated toward the patient brigade at the UIC Cancer Center, which Dr. Al-Tamati will speak to a little bit later. But I went to my first or second meeting, and Dr. Jan Pidiewski spoke about the Duffy protein allele. And he said casually, if anyone is ever going to do any kind of work with DOD or grant reviews, I'd be more than happy to work with you on those reviews and help you prep and get prepared as a reviewer. And I took him literally. And so I was applying to be a DOD reviewer, and then I got accepted. I immediately emailed him and said, "Hi, remember me?" And we met. I got a chance to talk to him a little bit about what I was interested in terms of ovarian cancer research. And he immediately set up a meeting for me to meet Dr. Shannon McLaughlin. And so, Dr. McLaughlin, you as an oncologist, as a researcher, you've opened your doors to me in terms of allowing me or accepting me to be a part of the gynecological disease team, asking me if I wanted to be involved in the interviewing process of onboarding oncologists at the Cancer Center. And so you really, truly embody the type of researcher that has the respect for and understanding of a patient advocate. I'd like for you to give the audience a little brief overview of what it is you do at the Cancer Center and for the University of Illinois at Chicago. And you're mute.
Yep, 21st century, Dr. McLaughlin. Thank you, Kimberly. I'm humbled to be here. And your discussion about Dr. Pidiewski, he's now our director of our Cancer Center, and I think his accessibility is unprecedented and is going to help us go a long way in building relationships with patient advocates. I had the pleasure of training with the late, now great Skip Granai, who founded the Program of Women's Oncology at Brown University. And for those who know him, Skip was a very unique human being, and he just got it. He got it before it was cool to get it. And he trained us to understand that our patient was a human being in the context of her family, and really beat out of us the desire and kind of habit of focusing on the disease process and neglecting the rest of all of those things. And I have committed myself to trying to pay that forward. And when I joined UIC as the director of gynecologic oncology here, it was and continues to be my goal to build a program with that philosophy that streamlines care, that integrates care, acknowledging that I appreciate you saying that I know how important it is, but I think I would say that I don't know what I don't know, and that's why I need you. And so in every opportunity I have to involve you and other advocates in the building of a program, that's an opportunity to keep the patient at the center. I have to say that at the summit that you and Dr. Lee and Dr. Kernett planned and held, I was there, and will never forget the moment at which one of the survivors asked the question, who decides what's researched anyway? And like, because all these years I've been so passionate about providing clinical trial opportunities to patients and understanding that participating in those clinical trials helps close that survival gap that we sometimes see between African-American women and other women. And never did I think that I might not be researching the right thing to begin with. And it was in that moment that I think that afternoon I emailed you and said, I need you on my disease team, because it was the ability to just decide that and do that at UIC is really a pleasure, and allows us to bring in that creativity that Dr. Lee brings up, because I think evidence-based medicine is so important and so crucial in academic medicine and cancer care, but it is a new concept. It's really a 20th century concept that's important, but I think as we started driving it in, we have not paid as much attention to the art of medicine, and we forgot to we talk so much about patient-centered care in our clinical practice, but I own this, I forgot to keep the patient at the center of the other aspects of academic medicine, the education and the research. So I thank you for blowing my mind.
Okay, well, you're welcome. One of the things I think that as we have worked together, I've gotten this great opportunity at the UIC Cancer Center to think outside of the box, to think about how patient advocates can be involved in the total infrastructure, ecosystem, if you will, of a cancer center. And I get these opportunities not only just as an advocate to be involved in grant reviews and to be a part of this disease team where we're looking at the accrual on clinical trials, and I'm learning so much beyond what I thought I would be able to do as an advocate. And I have to lay all of that at the feet of the Cancer Center, Dr. Jan Kilievsky, in terms of his 100% support of the things that I'm interested in doing. And so one of the things that we talked about after the summit was how well could we start doing these training modules to help patient advocates learn to do more in research advocacy. I've seen time and time again as a policy advocate going to the Hill, being given our sort of legislative ask, our script, if you will, to talk to staffers about increasing DoD funding for ovarian cancer research in particular. And yet, if they were to take a deeper dive and ask us questions about the specific research, which in one case, it actually happened, one of the staffers turned to one of us and said, well, not to me, but turned to one of us and said, tell me a little bit more about immunotherapy. And here this advocate only had the script about the legislative ask. She wasn't as prepared to speak to immunotherapy. And in that moment, I realized it's very important for us to start making these connections about what our cancer actually is. Sure, we have a story, we can tell that story. I believe 100% that we're a living expert, but we need to understand and have a shared language with researchers. And so Dr. Alam Al-Khamadi is our administrative director at the UIC Cancer Center. And so we have our mission statement there is more community to bench. And yes, as we've said constantly, patient-centered research and evidence-based research, where we are working particularly with patient advocates. But I believe at our cancer center, we really do, we walk the walk. And so Dr. Alam, you and I go back the furthest, and everybody in this group, right? We were in graduate school together in urban planning and public policy. And it's ironic that I was sitting I went to sit down at my, I think maybe my second or third patient brigade meeting, and I was about to start eating, and someone tapped me on my shoulder and said, "Is this seat taken?" And when I looked up and saw my classmates of almost 25, maybe years, I was blown away because I hadn't seen her in that much time. But I think we've more than made up that time in the last 2 or 3 years working together at the Cancer Center. Dr. Alam, tell everybody a little bit about yourself and the work that we do at the Cancer Center.
Absolutely. So thank you so much, Kimberly and everyone on the panel. I'm really quite honored. And as everyone has said, Kimberly just, when she's in the room, you feel her presence, and you exude the message that we all need to think outside the box, and you definitely, lead by example. In the Cancer Center, we do have it's a community-centered approach, and we work very closely with our communities. And it's not just to engage; we involve our communities, and we work with our. There's a group called the Patient Brigade, comprised of cancer survivors. We have a community advisory board comprised of community leaders who are themselves cancer survivors, who help inform in many aspects of our research, as does the Patient Brigade. We have a community outreach engagement office, CEHE, the Community Engagement Health Equity Office. And we have Cancer Center working groups who are comprised of the various research programs, so faculty, and we bring in trainees. So we take, we don't look at cancer and cancer disparities or cancer discussions research in a bi-directional, but it's a multi-pronged, multi-layered, very complex approach to the way that we look at cancer and cancer treatment. So by involving our cancer advocates and Kimberly, we ourselves learn quite a lot. And we say that, any sample, a tissue, blood, urine, anything that is before a researcher or a clinician came from someone. And that someone is an individual with a name, with a family, with a history. And this is what we teach our students. We say, this is not just a tissue. This is a someone. And this is the way that you need to look at the way that you approach research, or when you're sitting with patients. These are individuals, and they have an ID, they have an identity, and they have a history. And talk to that individual, talk to the patient, get their perspective, because it matters, and it matters in the way that we engage and we involve. And by having the multifaceted discussions, we become better at what we do, whether it's engagement in education training, in research, in the clinical practice. We become better, and then we end up advocating on behalf of our patients. So with Kimberly, she led, and it was a marvelous, marvelous idea among many. She toured Dr. Kidievsky's lab with other patient survivors, and it just ballooned from there. Lots of questions, lots of learning. And what we realized was our researchers in the lab were learning far more from our patients and the questions than the other way around. And so she developed what we call SACEP, Survivors Educating Scientists program. And so they developed, she and some MD PhD students developed modules, and they were done in layman's terms. And I will tell you, our MD PhD students learned quite a lot in the way that they need to approach not just research, but clinical care. And the experience has actually pivoted the students in now being more cancer focused, but being advocates themselves in the curriculum as well. And it's just, it's gone off like balloons. It's been presented at ASCO, and it's been adopted by AACR and several other national organizations. And we're going to continue involving our patient advocates, because we as cancer researchers and clinicians and population health advocates and researchers, we're the ones who are then able to better advocate on behalf of our patients.
You know what, I think about how far, as a cancer patient, how far I've come with ideas that I've had, and sharing those ideas with the panelists in one way or the other, and watching them come to fruition. The Survivors Advising Scientists educational program is a joy to work with these MD, PhD students in our cancer center. I want to spend the last couple of minutes sort of asking a round robin question for all of you. Because at the end of the day, as a patient advocate and someone who's wants research advocacy to be at the forefront for patients and caregivers and those advocates who might not see themselves doing research advocacy, how do we reach more advocates, particularly around gynecological cancers? I met someone just last night on Facebook. She messaged me and said, would you send out a message in your Facebook group for GCT asking more about different oncologists in a certain geographical area? And of course I was willing to do it for her, but she hesitated because of, I think she wants to stay anonymous for whatever reason. And in that moment, I said, this is the person. As a planner, one of the things I know when you're involved in community economic development or doing strategic planning, the person that's the quietest in the room has the best ideas. Guys, how can we start thinking about ways to engage patients before they become advocates? Is it in the visiting? Is it in the office visit? I hate to see another patient go through treatment and then into recovery and have no connection back to her voice, sharing her story, or even becoming an advocate. So I'll just start with Dr. Lee, and then Dr. Kernich, you can follow.
Yeah, thank you guys. This has been so enjoyable. I really feel also really lucky to be here and hearing from Shannon and Alham as well about what you guys are doing at UIC. I've heard it through Kimberly as well and seen it obviously, and it's just really exciting. And it's great that we're all in Chicago, so it'll be kind of fun to think about what we can do together. When I think about patient advocacy, I still think that there is this spectrum that we have to respect, because everybody's perspective is a little bit different about who wants to be involved with what and not. And people go through various different times in their cancer trajectory and journey and how they identify themselves and so I feel I think of it in terms of kind of the programming that we're thinking about at U of C, in terms of thinking about in that trajectory, when you get a new patient, where can we fill them into what they want to do and where do they feel comfortable, right? So many women really do start comfortable with like doing a race or having a family member join in, or the caregiver like, you know, does some kind of like advocacy race. And those are also really important avenues. And then creating like a space where like, hey, let us talk about like, what does it mean to be a education advocate? What does it mean to be an advocate who maybe like does a lot of social media stuff around GYN cancers, or is the like go-to person? What is, you know, so there's kind of like this like range that you have to develop. And so when we think about developing programs, you think about how do you then slot in who wants to be a policy advocate and what does that mean for them? And then who wants to be a research advocate? Because that's a lot harder and it's a lot more work and it requires a lot more passion about a different thing, you know? So like I have patients of mine who are like fantastic at like community organizing, but they want to do education events and they're fantastic at it, right? Like they're great at it and why, but they don't necessarily want to delve into reading a DoD paper, right? But they should also be equally aware, I guess, you know, of like what are these different, and then how do people pop in between those different spaces a lot.
I agree.
That's kind of what I'd like to see.
Dr. Kernan, what do you think?
It's a good question. I think there's kind of the big picture. We need just more of a presence in the world. We need to just raise awareness about gynecologic cancers and make it less of a taboo type topic. But on like a personal individual level, I do a lot of clinical trials research. And so I, you know, especially since that summit last year and in talking to Kimberly and, you know, realizing that a lot of patients and families are interested if we take the time to explain it. And so I really try to, when I'm talking about a trial, it's not just talking about the drug or the treatment that they're going to get, but it's also making sure that they understand in some way why we're doing this research, what came before it, what comes after it, where are they in the big spectrum of development, and how is their involvement potentially going to impact another woman in 20 years, and kind of understanding the broader idea of research with each person or each patient who's sitting in front of me, I think is one small way that I can try to increase awareness, because if they talk to their friend or the next patient, next time they come back and we have a different discussion, I think that's how we increase education as well.
Well, Dr. McLaughlin, I know you just asked me just last week that you had 2 or 3 patients that would be interested in getting involved with the patient brigade. So what other ways do you think we could get more patients and even caregivers involved in patient advocacy?
A couple of things. One, there's the individual physician-patient relationship. And I always, at some point in a patient's journey with me as a new patient, ask them what their goals are. And I even have created, it is in every templated note that we create to make a specific point about what a patient's goals are. And sometimes it's cure my cancer. That's kind of a common one, but sometimes it's, I need to get to my daughter's wedding, or in a couple of cases, it's been, I want to make this better for other women. And when that's their goal, then I say, in one specific example said, okay, let's get you through this. And then you and I will attack this together, because the patient knew that I was addressing some specific programmatic needs at UI. And so I think those conversations are outside the scope of the standard review of systems. But if we're gonna put the patient back at the center, then we gotta find a way to integrate them. One opportunity for that is probably the first official survivorship visit that we do. We have a lovely survivorship program here at UIC, and they've actually been integrated into our surveillance care for GYN cancers for over a year now. So that our, I don't want to use the word seamless, but our cooperation with them is routine. And when patients finish their first treatment, we recap, this is what you've been through. This is where we're going to go from here. And that's a good opportunity to say, what do you think about advocacy? In one, I think you have to be careful in talking with patients so that they don't think you're asking for money. Honestly, to get involved and engaged in something that they are now personal experts in, I think that's probably an opportunity to build it in.
Well, I know, Alam, my working at the Cancer Center as a research advocate has given me so many different opportunities to get involved in different layers of advocacy. We're going to give you the last words on this one. Uh, the Cancer Center has, of course, the Patient Brigade. It has its CEHE program. It has its community advisory boards. For that patient walking through the door of our hospital, how do they connect back to the Patient Brigade and to the Cancer Center? You turn your mic off, mute off.
I was just going to say, I think the first step is, have we built a relationship in the community? And without a trust relationship, people aren't necessarily going to be an advocate. What would they advocate on if you haven't built a relationship? And so I think the first step is, and going back to our urban planning roots, you build a relationship directly with the communities, and you build that trust. And then that way, when they, and you need to, I think as a cancer center, as an institution, regardless of where we're located, communities need resources. And if we're not willing to invest in our communities, why would they come to us? And then why would they trust us and trust their lives and their treatment plans to us if we haven't taken the first step? And once they do come through the door, we have to continue to nurture the trust relationship. And when we invite them to become, and I'm not going to use the word engaged, it's involved. When we invite them to be involved, in the treatment plan, we're really listening, and we're providing, but we're also, we're taking. So it's again, I'm going to just go back to that multi-directional relationship and investment, and our ability to hear the patient. Once they know that we're listening, then we need to act. And when we act, they're going to advocate. And I think that's how we've been successful in involving our Patient Brigade, our CAB, SACEP, all the programs that we have been engaged in enrolling out there. We're learning again, and we continue to build, but I think this is hopefully a first step.
Well, thank you all. In terms of trust bearers, you all are, to me, my most important trust bearers. I sort of told you the things that I wanted to do as an advocate, and trusted you to help me execute those and to support me. And I'm so grateful to have having the opportunity today to just speak with all of you all in one space. Dr. Joanna Burdette couldn't be with us today, who's also U of I Cancer Center in the Ovarian Cancer Research Lab, but it's just so awesome to be in your space today. And Hala, thank you so much for trusting me with your very first series out of 2021. Just again, it's so important that there's a connection for patient advocates in cancer research and all types of research, and that we all strive to work together. So thank you again, Hala, for this opportunity.
Thank you, Kimberly, and thank you to our esteemed panel. I couldn't think of a better way to kick off our Empowering Partnership series. You guys kicked it off in the best way possible. Thank you all for your partnership, your support, and certainly I know our audience can learn so much from this discussion today, and we thank you all once again. Thank you again to our audience also for joining us today. Please join us next week. Same time, same channel, 2 p.m. on Tuesdays, Tuesday Table Talk on our YouTube channel. We look forward to more conversations about empowering partnerships over the next few months. And certainly we do always appreciate everyone who joins us, whether live or later. And certainly we ask, if you can, subscribe to our channel. That way you get immediate notifications of our series. So thank you all and so much. If our panel could just be on mute and pause for a few seconds while we close out the stream. And again, thank you all so much. Take care.